We do now have Melissa Reed, President and CEO of Planned Parenthood Keystone, on the phone. Melissa, can you hear me okay?
I can. I hope you can hear me now.
I can. Wonderful. Thank you so much for joining us. Let's start and talk about some of the services that Planned Parenthood offers.
Yes, I'm happy to. Planned Parenthood Keystone is an essential healthcare provider in this community, and we provide a wide range of reproductive and sexual health care as well as sexuality education. So that can include birth control, STI testing and treatment. It includes life-saving cancer screening, well woman exams, and abortion care. So we really are, as Governor Wolf deemed, an essential safety net for the people of this community in accessing health care.
So you've been able to stay open, but how have things changed through the pandemic? What services you offer? Is there anything that got restricted during all of this?
Well, as I mentioned, Governor Wolf said we were an essential healthcare provider, so we were not required to close because the services that we provide are so important to our patients. However, we really wanted to prioritize the health and safety of our community as well as the health and safety of our staff. So as we worked to secure enough personal protective equipment, we quickly pivoted to telehealth services. And we were one of the first Planned Parenthoods in the country to go completely online through telehealth services. And we're able to provide almost all of our services through a live video or through a phone call. And already we have been able to serve over 650 patients that way. And then in addition, for those folks who are unable to travel, immune compromised, were not comfortable coming into the center for care, in addition to the telehealth services, we launched in-home STI testing. We're the first Planned Parenthood in the nation to launch that. And then we also have a mobile app where people can access birth control and urinary tract infection treatment fully online and delivered straight to their door.
Do you expect to see this telehealth continue? Do you expect to see your patients use this long term? And is that a good thing, bad thing? Talk to us a little bit about that.
Patients have been so thrilled with this service. We do regular patient feedback surveys, and the feedback has just been universally positive. So I do anticipate that this will continue. And one of the things I'm most excited about is that for the first time, we're really able to access patients in our most rural communities. So, for example, we now have patients getting care from Bradford and Tioga counties, and they ordinarily would have had to drive hours to seek reproductive health care, and now that's delivered straight to their door.
So during the course of this pandemic and the stay-at-home orders and the shutdown of many businesses, have you seen a rise or fall in the number of patients that you're seeing on a weekly basis?
Well, we certainly saw a dramatic decrease in March. When the coronavirus pandemic began in this country, and certainly we were hit hard in Pennsylvania and the counties that we serve, people really were concerned about their safety, really wanted to pay attention to Governor Wolf's stay-at-home order. And so in March, we saw about a 75% drop in patients. And that's why it was so important for us to provide telehealth services really quickly. And we were able to transform into providing those telehealth services within just a couple of weeks, which I think is really remarkable and really speaks to the commitment and ingenuity of the staff that we have. And then I'm also happy to say that because of the generosity of our community and others, we were able to secure enough PPE so that in May we were able to open our doors for in-person visits once again, and our patients have been very, very eager to access care in that way as well. So I see telehealth continuing to grow, but also our patients who need individually hands-on care, perhaps they need an IUD, something like that we can't provide through telehealth, then they're very happy to be able to make their appointments in person.
Sure, Melissa, we only have a minute left, but if you could talk to us, there's some information on your website in regards to COVID-19 when it comes to sexual health, pregnancy, and breastfeeding. What do people need to know in pertaining to those topics?
Well, people need to continue to be very, very careful and follow the CDC guidelines, right? So practicing social distancing, making sure that they're washing their hands frequently and sanitizing regularly, wearing their masks. When we are seeing patients, we mask them when they come into our sites, into our medical centers, and then we need to have their family and guests wait outside for them. So we're being very, very cautious. But it's also important for people to remember to take care of their sexual and reproductive health. If a woman or a man has a concern about perhaps having an STI or some changes in their breast tissue, then absolutely prioritize that care, and we're here to help.
Great. Melissa Reed from Planned Parenthood Keystone. Thank